When an artery has been cut, the blood is red and spurts out every time the heart beats. When a vein has been cut, the blood is dark red and flows steadily. Slight pressure on the wound will help the bleeding to stop. In a wound where a capillary has been cut, blood oozes and is red. The first step to control bleeding is to apply direct pressure. When applying direct pressure, do the following. Put on gloves. Use a clean cloth or pad to cover the wound. Apply firm pressure. If the cloth becomes soaked with blood, place another one on top. Removal of the first cloth will restart the bleeding. The next step to control bleeding, if direct pressure does not seem to be working, is to elevate the extremity. Hold the bandage firmly in place and elevate the extremity slightly. If bleeding continues, it may be necessary to apply pressure over a pressure point. A pressure point is a site where a main artery lies near the surface of the body over a bone. By applying firm pressure of the artery against the bone, bleeding can be diminished. There are 4 pressure point areas. The pressure point for the arms is called the brachial artery. This artery is located in the upper arm between the biceps and the triceps. Take a minute and try to find the brachial artery pressure point on yourself. You will know if you are correct in finding the location because you will feel a pulse there. Put firm pressure on the area. Controlling bleeding for the lower extremity means locating the femoral artery and pressing firmly with the heel of your hand or fingertips. The femoral artery is located in the crease of the groin. Next time you get ready for bed, try to locate the femoral artery on yourself. You will know if your location is correct because you will be able to feel a pulse. An application of a pressure dressing over the bleeding wound may be necessary. Pressure bandages should be applied snugly over the bleeding wound. Always check the fingers for warmth, color, and feeling after you have applied a pressure dressing. The goal is to decrease blood flow, not stop it. To control bleeding, apply direct pressure. Elevate the extremity. Use pressure points. Apply a pressure bandage. Nosebleeds are fairly common and may be caused by an injury to the nose, blowing the nose, or exposure to cold or dry air during the winter months. Nosebleeds are not usually serious. Most nosebleeds can be controlled in 10 minutes. Most residents can pinch their nostrils shut themselves. Wear gloves if you need to assist them in applying pressure. The resident should sit down and lean forward. Pinch nostrils together for 10 minutes. Pinch for an additional 10 minutes if needed. Medical attention should be obtained if the nosebleed does not stop after 20 minutes of pinching pressure. Nosebleeds can also result from a head or neck injury. If you suspect a head or neck injury and the nose is bleeding, do not pinch the nostril shut. Doing so would cause further harm. Heart disease is a leading cause of death for people over the age of 45 in the United States. Although heart attacks may seem to be sudden, most are a result of lifestyle choices that are made every day. Most often called a heart attack, myocardial infarction means the death of a heart muscle. This is most often associated with coronary artery disease. Researchers have identified factors that increase a person's chances of having a heart attack. These factors are called risk factors. Some risk factors can be changed, such as smoking, blood pressure, diabetes, weight gain, while others cannot be changed. For example, having had family members who have had heart disease can increase risk for a heart attack. It is always a good idea to identify your own risk factors and work on changing the ones that you can. The signs and symptoms of a heart attack may vary from a feeling of indigestion to severe crushing chest pain. Many people may deny that they are experiencing a heart attack and sometimes delay seeking medical attention. Signs and symptoms of a heart attack include pain or pressure in the chest, arm, neck, or jaw, difficulty breathing, shortness of breath, pale, cool, or sweaty skin, lightheadedness, weakness, or denial that anything's going wrong, or feeling of impending doom. Remember that not all of these symptoms will occur with every heart attack. If some start, do not delay. Recognizing a heart attack and getting the necessary care at once may prevent a resident from going into cardiac arrest. If any symptoms of a heart attack begin, signal for help and stay with the resident. Monitor breathing and pulse. Keep the resident in a position of comfort, usually sitting unless they are weak. Then lie them on their side. Loosen clothing to ease any difficult breathing. Reassure the resident. If you are trained, be prepared to do CPR. Remember, time is muscle. The longer you wait before calling for assistance, the longer the heart muscle has time to become permanently damaged. Stroke, or brain attack, is a leading cause of death in Americans. A stroke is a blockage or rupture of a blood vessel in the brain. An increased awareness of what it means to have a healthier life can decrease the risk of stroke. Knowledge of risk factors that may lead to a stroke is an important first step. As with a heart attack, risks that can be changed to prevent a stroke may be high blood pressure, heart disease, and smoking. Risk factors that cannot be changed include heredity, age, gender, and race. Do you have any of these risk factors? Signs and symptoms of stroke include sudden weakness or numbness of face, arm, or leg on one side of the body, sudden severe intense headache, loss of speech, speech slurred or incoherent, loss of consciousness, dimness of vision, particularly in one eye, unsteadiness, or a sudden fall, loss of bladder control. Treatment for a stroke requires an immediate signal for help and stay with the resident. Maintaining airway, breathing, and pulse. Make sure to lay resident on their side to keep them from choking on their own saliva. Provide the resident with assurance. When the normal workings of the brain are disrupted by injury, disease, fever, or infection, the electrical activity of the brain becomes irregular. This can cause a loss of body control known as a seizure. If seizures are chronic, they are usually controlled by medication. 3 general types of seizures include petit mal or absence, where we see brief blackouts, inattentiveness, or staring. Psychomotor seizures present themselves